I'm sorry. Can't leave. We have another presentation which has been planned. Toby Weiss is a local resident who is Director of Cultural Sensitivity and Jewish Programming for the Metropolitan Jewish Health System. MJHS Hospice is the largest provider of Jewish hospice care in New York and in the United States. This MJH Hospice and Palliative Care is endorsed by the Agudas Yisrael of America and provides care to all people, but commits to delivering all care to the Jewish community in accordance with Halacha. She's here to talk a little bit about hospice care in case, unfortunately, in case your chemo doesn't work. Toby.
By the way, do you know if there's a cure to diabetes?
No, that's do with tonight.
Knees.
And they ask questions that have nothing to do with it.
I'm almost embarrassed to follow Dr. Kaplan. He was amazing. So I have to tell you that my mother died of colon cancer, and we had an oncologist, and I have to say that he was really a shaliach from God, and I think that all good doctors are shlichim from God. And when he told us that we should consider hospice for my mother, I really wanted to put a bullet in his head. I never heard of hospice. I didn't know what it was. I think most people in our community don't really look to hear about this kind of information. Can you hear me? Am I speaking loud enough? Yeah. But lo and behold, we moved my mother here to Queens, and we had hospice for her, and the doctor told us that she wouldn't live more than a few weeks. She lived for another 8 months. And after she passed away, I have to tell you that I realized this hospice thing that I knew nothing about prior was unbelievable. And the only thing that was missing from it in my family's experience was that there wasn't a shred of anything Jewish. There was no Jewish spirituality. There was nothing at all that lent itself to a frum life. And I committed to try, at that point, to try and find out if there would ever be any kind of a Jewish hospice or Jewish aspect to hospice. And long story short, I became involved with Metropolitan Jewish Hospice at the time voluntarily, and it wasn't until years later that I ended up working for them. And I'm here to tell you today a little bit about what you need to know as a community about what this thing called hospice is and what this thing that we have today called palliative care. There's a community-based, I'm going to start with palliative care, and then we're going to move on to hospice. I'm going to cover with you as well how it gets paid for. I'm going to cover with you what it means as far as what you get. What's in it for you? What's in it for the patient? And how do you utilize it to its best advantage for your purposes? I'm not going to talk about hospice philosophy, because hospice philosophy is not what we look for and not what we try to promote when we talk about end-of-life care options within the Jewish community in particular. What we do try to commit to in hospice, and I think that hospice is holy work, no matter who you do it for, no matter who you work for. It's not an easy space to live in. But when you can't add days to a person's life, what we try to do is add life to a person's days. And we try to do that in a way that is healing. Healing physically, because you still treat a person. Healing spiritually, because you need to speak to a person's spiritual needs, their belief systems, their Yiddishkeit, or whatever belief systems they have. and you have to heal emotionally. And it's interesting and unfortunate at the same time that in many families, that end-of-life experience is fraught with a lot of conflict. It's not always a time when everybody comes together and sings Kumbaya. It's a time where people have different philosophies and different beliefs and different wants. And it really needs to be about what's best for the patient. And that's what we call in medicine today patient-centered goals and patient-centered care. So let's talk first about palliative care. Almost every hospital today has something called palliative care. If you're in a hospital and you had a hip replacement, or you're in a hospital and you have some sort of sepsis, you have some sort of infection, or whatever you're in the hospital for, and if you have symptoms, distressing symptoms like pain, agitation, insomnia, any kind of additional burden to your symptoms, to your disease process, who do they call? They call the palliative care consultation team. And they come inside the hospital and they manage your pain. But when a person goes home, the palliative care consultation team in the hospital doesn't go with you, doesn't go with the patient. There are community-based palliative care programs. Let's first define what palliative care is, okay? The national consensus definition for palliative care is that it seeks to prevent and relieve pain and suffering and ensure the highest possible quality of life regardless of the age of the individual or stage of life-limiting disease. Palliative care allows for individuals to include curative interventions and therapies in their treatment plan. I'm going to be speaking to you about community-based palliative care. We have a community-based palliative care program where you have an interdisciplinary team that actually comes to your home and works with you, a medical director, a nurse practitioner, and a social worker. All of the nurse practitioners and physicians are board certified in palliative medicine, which is a specialty today in medicine. There are residency programs for it. And the operative term here that I want you to hook into is that it includes curative interventions. That means that a person can have palliative care, pain and symptom management, even if and throughout their course of chemotherapy, throughout their curative interventions, whatever that life-limiting disease process is that they have and they are still trying to cure. You are still entitled and can access community-based palliative care, where you will have an interdisciplinary team that can come and help manage your symptoms while you're still going to all of your other doctors and you have all of your other caregivers. It does not preclude or mitigate any of that. It's simply an extra layer of support that you can benefit from while you do everything else.
You have a number we can call?
Yes, if you take a packet, the phone number is in there. Packets are in the back. Could you advance the slide, please? So palliative care is a therapeutic model that is intended to reduce burden of illness, maintain quality of life, minimize suffering, and it ensures that the care is guided by goals that are consistent with medical realities, meaning that there is clarity and accuracy in what the disease process is that a person is dealing with, and that the values and preferences of the patients are adhered to. Care has to be guided by a person's values and beliefs. There are 3 recent healthcare legislative acts that were passed. Something called the Family Healthcare Decisions Act that was passed in June 2010, the Palliative Care Information Act that was passed in 2011, in February 2011, and the Palliative Care Access Act that was passed in September 2011. And one of the things that the Palliative Care Acts now mandate is that physicians must speak to patients about their terminal diagnoses and offer different options, care options, when a person has a life-limiting or terminal illness. Within the Orthodox community, that sometimes is halachically challenging.